Most people believe that routine health checkups are always a smart move, especially as we get older. But what if I told you that after a certain age, some of the most common tests could actually put your life at risk? I know, it sounds shocking, but not all screenings are harmless. In fact, for people over 70, some checkups may do more harm than good, leading to false alarms, unnecessary anxiety, and even risky treatments that affect your independence and well-being. This isn't fear-mongering, it's a shift in modern medicine that more and more doctors are recognizing. The older we get, the less a one-size-fits-all approach makes sense. In this video, we're going to take an honest look at 7 specific tests that many older adults are still being encouraged to do, but that even experienced doctors often avoid for themselves. You'll learn why these tests are still so widely recommended, the hidden risks they carry, and what safer, smarter alternatives exist. Because after 70, the goal isn't just to live longer, it's to live better. And that means medical care that respects your age, your body, and your priorities. So if you want to protect your health without getting trapped in a cycle of over-testing and over-treatment, this video is for you. And make sure you stay until the very end, because the last test on this list might truly surprise you. It's one that many people over 70 still do every single year, without even questioning it. A test that seems harmless, responsible, even essential, but could actually be setting you up for a cascade of unnecessary stress, medications, and medical interventions. You won't want to miss it. But before we begin, take a quick moment. If this kind of content speaks to you, if you're interested in natural ways to stay strong, sharp, and independent after 50, hit that subscribe button and turn on notifications. That's how you let YouTube know you want more real-life wellness tips, simple home remedies, and easy-to-follow strategies to help you feel more energized, balanced, and in control of your health. Let's begin. 1. Colonoscopy. Colonoscopy has long been hailed as the gold standard for preventing colon cancer. For people in their 50s and 60s, especially those with risk factors, this test has saved countless lives by detecting precancerous polyps early. But what many people don't realize is that the risk-benefit balance of this test shifts dramatically after a certain age, especially for those over 70 who are symptom-free and have a history of normal screenings. Here's why. Colonoscopy is not a harmless exam. It's an invasive procedure that requires bowel cleansing, sedation, and the insertion of a flexible tube deep into the colon. Each of these steps poses increasing risk as we age. The bowel prep, drinking large volumes of strong laxatives to completely empty the intestines, can lead to severe dehydration, electrolyte imbalances, and kidney strain, which are far more dangerous in older adults. Many seniors, particularly those living alone, are vulnerable to falls, confusion, or dizziness during this prep process, sometimes even requiring hospitalization before the procedure ever begins. Then there's the sedation. As we age, the brain becomes more sensitive and the body metabolizes drugs more slowly, increasing the risk of lingering confusion, memory problems, and even post-operative delirium, a condition that can take weeks or months to resolve. And finally, there's the procedure itself. While complications like bleeding or perforation are rare, their impact is magnified in older adults. Recovery is slower, and even a routine follow-up can become a major medical event. But the real concern isn't just the procedure, it's what comes next. Let's say the doctor finds a small polyp. It might be the kind that takes 10 to 15 years to turn into something serious, if it ever does. But once it's found, it sets off a chain reaction. Repeat scopes, biopsies, even surgeries, all for something that might never have caused harm during your lifetime. That's the part many people aren't told. Colonoscopies are designed to prevent cancer over a long time horizon. But if you're 75, 80, or beyond, your health goals may have shifted. Your focus may be on staying independent, avoiding complications, and living well now, not going through invasive procedures for what might happen 15 years down the road. There are safer, less invasive options today, like stool-based tests, that can still monitor colon health without putting your body at risk. And if you're not experiencing symptoms, it's perfectly reasonable to have an honest conversation with your doctor and ask, is this really necessary? Because sometimes the most responsible choice isn't doing more, it's knowing when to do less. 2. Full body scans. There's something undeniably tempting about the idea of a full body scan. A comprehensive CT or MRI that peers inside your body from head to toe, searching for any sign of trouble before it becomes serious. The promise is peace of mind and early detection, right? But here's the catch. For seniors over 70, this approach can be more dangerous than helpful. Full body scans are incredibly sensitive machines. They detect every little detail, including many tiny incidental findings that are actually harmless. Small nodules, benign cysts, or minor abnormalities that would never impact your health during your lifetime. Yet, these findings often trigger a cascade of further tests and interventions that can quickly spiral out of control. Imagine this scenario. A 78-year-old woman undergoes a full-body scan during a health fair. The scan spots a tiny lesion on her kidney, something so small it had never caused any symptoms and likely never would. But the word lesion sparks alarm, leading to biopsies, surgery, and months of recovery. The treatment leaves her weaker, drained, and less independent than before. Why does this happen? Because the older body is not the same as a younger one. The physical toll of additional procedures, biopsies, surgeries, recovery, can be severe. Older adults have reduced resilience, healing takes longer, and complications such as infections or organ damage are more common. There's also an emotional cost that's harder to measure. Living with the fear and uncertainty of what if can overshadow the joy of the healthy years you have. The mental burden of incidental findings can trigger anxiety and diminish quality of life. Financially, these scans can be a heavy burden. Most insurance plans don't cover full-body scans without a clear medical indication, leaving seniors to foot the bill out of pocket for tests that may lead to even more costly procedures. The key takeaway? Full-body scans are not preventive medicine. They're diagnostic tools meant for when there's a specific concern. Using them as routine screening in older adults risks overdiagnosis and overtreatment. Instead, focus on regular doctor visits, paying attention to your body's signals, and targeted testing based on symptoms or risk factors. 3. Cardiac stress tests. The treadmill stress test has long been a staple in cardiovascular care. The concept is straightforward. By pushing your heart to work harder under controlled conditions, doctors can detect signs of heart disease early on. In middle age, this approach can be life-saving. However, once you pass the age of 70, especially if you are symptom-free, no chest pain, no unexplained fatigue, no shortness of breath, the benefits of routine cardiac stress testing become questionable, and the risks rise considerably. Why? Because aging naturally brings changes to your cardiovascular system. Arteries become less flexible, blood pressure fluctuates more, and the electrical signals regulating your heartbeat may show minor irregularities. These changes are often normal adaptations to aging, not indicators of disease. Unfortunately, cardiac stress tests aren't designed to differentiate between normal age-related changes and true pathology. This can lead to false positives, results suggesting heart problems that aren't actually present. The consequence? A cascade of additional, often invasive procedures. Angiograms, cardiac catheterizations, stent placements, or bypass surgeries. While these interventions save lives in appropriate cases, they also carry significant risks, especially for seniors. Older adults are more vulnerable to complications such as bleeding, kidney damage from contrast agents used in imaging, infections, and adverse reactions to anesthesia. Recovery times are longer, and the physical toll can lead to a loss of independence. Consider Harold's story. A healthy, active 74-year-old with no cardiac symptoms who underwent a routine stress test as a precaution. The borderline results led to a cardiac catheterization that revealed some non-obstructive plaque. Despite no urgent blockage, Doctors placed a stent as a preventive measure. Weeks later, Harold developed severe internal bleeding related to blood thinners prescribed post-procedure. He spent months recovering, and his quality of life suffered profoundly. Leading heart specialists and geriatric medicine experts now advise against routine cardiac stress tests in asymptomatic older adults. The evidence shows these tests do not reduce heart attacks or mortality rates in this group. Instead, the focus should shift to symptom-based care. If you experience chest pain, dizziness, unexplained fatigue, or breathlessness during activity, then testing is warranted. More importantly, prioritize proven lifestyle strategies. Regular walking, a balanced diet rich in heart-healthy nutrients, stress reduction, and maintaining social connections. These measures support heart health far more sustainably than indiscriminate testing. Ultimately, healthy aging is about discernment, knowing when medical intervention is necessary and when it may cause more harm than good. Your heart deserves care that protects your quality of life, not procedures that threaten it. After 70, wise healthcare means knowing when to act and when to avoid unnecessary interventions that could compromise your health rather than protect it. 4. PSA testing without symptom. For decades, the PSA blood test has been promoted as a simple way to catch prostate cancer early, especially in men over 50. And while early detection can be life-saving in some cases, routine PSA screening in older men without symptoms is now one of the most hotly debated practices in modern medicine. Why? Because the PSA test isn't a definitive diagnosis. It's a trigger. It detects elevated levels of a protein produced by the prostate, but these levels can rise for many reasons, most of which have nothing to do with cancer. Benign prostatic hyperplasia, inflammation, or even a recent physical activity like cycling can influence the result. In men over 70, the chance of having a slow-growing prostate cancer increases, but so does the likelihood that it will never become dangerous. In fact, many prostate cancers found in older men are so indolent that they would never cause symptoms, spread, or shorten life expectancy. But once a PSA result comes back high, it often sets off a chain of events: repeat testing, biopsies, MRI scans, and sometimes aggressive treatments like radiation or prostate removal. These interventions carry serious risks, including incontinence, erectile dysfunction, infections, and long-term psychological impact. And yet, in many cases, the cancer detected may never have progressed at all. This is what doctors now call overdiagnosis, the identification of a disease that would never have caused harm, but which ends up being treated anyway. In older adults, the harms of overdiagnosis are magnified. The body heals more slowly, the emotional toll is heavier, and the benefits of treatment are often marginal at best. That's why leading organizations like the U.S. Preventive Services Task Force and the American Urological Association now recommend against routine PSA screening in men over 70 who don't have symptoms or a high-risk profile. Instead, the better path is shared decision-making, an open, informed conversation with your doctor about your personal risks, values, and health priorities. If you're feeling well, have no urinary symptoms, and no strong family history of aggressive prostate cancer, it's entirely reasonable, and often wise, to decline PSA screening after a certain age. Because good medicine isn't just about detecting every possible problem. It's about protecting your quality of life, honoring your body's natural course, and avoiding harm that comes disguised as prevention. 5. Routine mammograms in very elderly women. For years, women have been taught to get regular mammograms as a critical tool for detecting breast cancer early. And for good reason. In middle age and early senior years, this screening has saved lives. But there comes a point when the equation changes. Once a woman reaches her late 70s or 80s, especially if she has no symptoms and no personal or family history of aggressive breast cancer, routine mammograms may offer little to no benefit, and potentially significant harm. Why? Because mammograms are designed to detect slow-growing tumors, many of which develop so gradually that they would never cause illness or death during the remaining years of life in older adults. But the problem is, once something is found, even something harmless, it rarely ends there. A suspicious image can lead to repeat scans, biopsies, and sometimes surgery or radiation, all of which can be deeply taxing on an aging body. These procedures come with real risks: pain, bleeding, infection, adverse reactions to anesthesia, and prolonged recovery. And emotionally, the fear and stress that follow a positive screening, even a false one, can be overwhelming. There's also the issue of time horizon. Most breast cancers found by mammogram take years to grow into something life-threatening. For a woman in her 80s who's feeling well and has had clean screenings in the past, the chance that a new finding would impact her lifespan is extremely small. That's why many medical organizations, including the American Cancer Society and U.S. Preventive Services Task Force, now emphasize the importance of individualized decision-making when it comes to mammograms after age 75. They no longer recommend automatic annual screening for all women in this age group. Instead, they encourage women to ask, "Is this test likely to help me live longer? Or could it introduce stress and complications I don't need?" If you're in good health, aware of your body, and not experiencing any symptoms, it's perfectly valid to skip the routine mammogram after a certain age. It doesn't mean you're ignoring your health. It means you're prioritizing well-being over protocol, and that's a form of wisdom. 6. Repeated bone density scans. Without clinical need, bone health is a legitimate concern as we age, especially for women after menopause and for older adults at risk of osteoporosis. That's why a bone density scan, or DEXA scan, is commonly recommended around age 65. It's a valuable tool to assess fracture risk and guide treatment if necessary. But here's the critical point. Repeating this test frequently in very elderly people without any symptoms or changes in health rarely provides meaningful benefit and may lead to confusion, overtreatment, or unnecessary anxiety. Bone density changes very slowly, often over the course of many years. Once a person has had a baseline scan, and if needed, started appropriate treatment, doing the test again every year, or even every 2 years, usually doesn't change the treatment plan. And in those with advanced age, especially over 80, the goal often shifts from aggressive intervention to fall prevention, mobility, and preserving independence. Yet, many older adults continue to undergo routine DEXA scans, often because it's become a habit, or because the medical system is operating on autopilot. Here's the problem. A minor shift in bone density can lead to a worsening result, even if the person is feeling well and not experiencing any fractures. This can prompt changes in medication, including starting or increasing drugs like bisphosphonates, which come with their own risks: jaw problems, digestive issues, and even rare fractures related to long-term use. For someone who is otherwise stable and not at high risk of falling or breaking a bone, this chain reaction may cause more harm than good. And let's not forget the emotional toll. Being told your bones are worse can lead to fear and a sense of fragility, even if the change in numbers has no real impact on your daily life. The smarter approach: if you've already had a DEXA scan and there's been no major weight loss, no recent fractures, and no significant health changes, your doctor may decide that another scan isn't necessary. Clinical judgment, fall history, and your actual mobility are often far more important indicators of your fracture risk than a small numerical change on a scan. After a certain age, it's time to stop chasing perfect numbers and focus instead on what truly protects your bones: strength-building exercises, vitamin D, good nutrition, and avoiding medications or environments that increase your fall risk. In other words, fewer tests, more movement. If you're still here with me, it means you're serious about taking control of your health. And that's the most important first step to feeling stronger and more vibrant every day. If you're looking to take your health and well-being to the next level, you might love being part of the 21 Days Reset for Seniors. It's a simple, guided challenge designed to help you feel better, move more, and build habits that truly last. because it's the little changes that make the biggest difference. If you're ready to improve your health and quality of life, the link is in the first pinned comment. 7. Repetitive lab checkups without clinical indication. Getting regular lab work has become almost automatic in modern healthcare. Blood tests every year, or even every few months, are often seen as a responsible, preventative habit. But after the age of 70, especially in people who are stable, asymptomatic, and not undergoing active treatment, routine lab panels done just to check may do more harm than good. Here's why. The human body changes with age, and so do normal lab values. Slight shifts in kidney function, liver enzymes, or blood counts can be completely harmless, yet they often trigger a medical reaction. A borderline result might lead your doctor to order even more tests. That can mean imaging studies, referrals to specialists, or even biopsies, all based on something that may never have mattered. These domino effects can cause unnecessary stress, financial burden, and even medical complications. Let's be clear. Lab tests are essential when they are tied to symptoms, new medications, or a specific concern. But repeating a full panel every year without any clear reason, especially if your last results were normal, has little proven benefit in very elderly patients. In fact, studies have shown that routine annual labs in healthy older adults rarely uncover significant disease. Instead, they often reveal harmless age-related changes that lead to what experts call cascade medicine, treating lab numbers rather than treating people. And in the process, you may be prescribed new drugs, face invasive follow-ups, or experience the anxiety of being told something is off, when your body is simply showing signs of natural aging. Let's not forget the emotional side of this. When an older adult is repeatedly told their blood work is a little abnormal, even if nothing comes of it, they may begin to feel fragile, vulnerable, or broken, undermining the confidence that's essential to healthy aging. The wiser path is selective testing, based on how you feel, changes in function, or new risk factors, not automatic repetition. If your energy is steady, your appetite is good, and you're living well, it's okay to pause and ask, what exactly are we looking for? And how will this test improve my quality of life? Because at this stage, the goal isn't to chase perfect numbers. It's to protect your clarity, your stability, and your peace of mind. Now, just to be clear, I'm not saying you should never do these tests, but you deserve more than automatic checkboxes. You now have the knowledge to bring into your next doctor's visit. Use this information as ammunition for an honest conversation about what truly serves your health, your goals, and your life at this stage. Because real prevention isn't just about doing more, it's about doing what matters most. Before you go, I'd love to know, have you ever questioned whether all your routine tests are truly necessary? Which one from today's list made you stop and think the most? Share your experience in the comments below. And if this video helped you understand how simple, natural choices can transform your health after 50, please hit the like button to show your support. Thank you for watching. And if you found this information valuable, don't forget to subscribe to the channel. It's free and really supports us in bringing you more reliable health tips. Just hit the subscribe button right below. And while you're there, tap the bell icon so YouTube alerts you every time we post new videos about natural nutrition and wellness. Thanks so much for watching. See you in the next video.